Welcome to the future of healthcare marketing is digital. I'm Andrea Simon, and this is Healthcare Innovations Trends from the Trenches, a webinar series that we've set up to help share with you what we see happening in the field quickly before it becomes old, and so you can get a head start on what's happening. I'm a corporate anthropologist. I'm also president and founder of Simon Associates Management Consultants. We work with organizations, many of which are healthcare organizations, that need to deal with changing business environments or need or want to change. Ben Dillon is our presenter today. Ben is co-owner, vice president, and eHealth Evangelist of Geonetric. And as you'll see from the presentation today, he's got a wonderful background and experience and lots to share with you. He serves as the company's thought leader. He writes and he speaks extensively about Geonetric's research in eHealth and the industry that's leading efforts of its clients to adapt. I met Ben at several Society for Healthcare Strategy and Market Development conferences, and I also served with him on a committee dealing with social media and healthcare. But I think what we really like about Ben and the reason we selected him as part of this webinar series, he's just a perfect person to talk about what's going on in eHealth. And this is what people say about him. He follows healthcare technology trends like other people follow sports teams. And so I really think he's a perfect addition to our team here. Our webinar series up till now, I found out, ironically, is all women. Ben is our first man, and we have several coming in the next several months. So Dr. Maudlin will be with us in May, and Sam Basta will be here in June. And so we have a whole series that'll blend the mix. But as you can see, these are very interesting participants, all of whom had different perspectives to share with you, from branding and rebranding, like Diane Auger, or Chris Barlow, who spoke at length about what she see happening in physician relations, and Linda McCracken, who was taking apart the data and showing us how big data can really provide us insights. And Margie Davino, of course, gave us last time a marvelous presentation about all the things from a legal and regulatory point of view, but all the ways that doctors need to begin to understand the options. The webinar series, Why Trends from the Trenches? I'm an anthropologist, and we begin most of our work getting to know our customers, our clients, by spending a day in their life and beginning to see in the trenches what's actually happening. We know how difficult it is for people to tell us. They really don't know, but they can begin to show us. And in their daily life, we begin to understand what's really happening. So bringing an anthropological perspective to the healthcare transformation going on has proved very vital. But what we really tell folks is that our whole purpose is to help them have new eyes. Marcel Proust, the real voyage of discovery consists not in seeking new landscapes, but in having new eyes. And that's indeed what's going on now. How do I see, feel, and think in new ways? The problem is that we don't see things as they are. We see things as we are, and we project onto what's happening with our known values, beliefs, and culture, with what we are comfortable with and our habits. And we end up seeing what we believe to be true, which is more about ourselves, not really what's happening. This is not uncommon for a client board. There's so much going on, there's so much data, big data, little data, experiences in daily life, that it's difficult to sort what to do and where in order to keep moving in the right direction. And I have several clients now who are just stalled, which is often what happens when there's too much data. So our job is to help you see, feel, and think in new ways and convert those ideas into big innovations. Today, Ben came on board here to talk about this, which is a great visual of the amazing complexity going on in today's world as it goes mobile. And he'll show you how fast it's going mobile. 70% of the people still use desktops, but that's really decreasing relative to the number of people who are using all sorts of mobile devices in all sorts of new ways. So please let me introduce to you today Ben Dillon. Ben will share his new research from the 2013 survey on initiatives in health. He'll examine how leading healthcare organizations are using digital communication tools to attract and engage patients. And he'll explain how he sees our discipline evolving to support the healthcare organizations of the future. Switch our controls now and hand it over to Ben. Thank you, Ben.
Hello, everyone, and welcome. As Andy mentioned, I'm Ben Dillon. I'm the Vice President and eHealth Evangelist at Geonetric, and we're going to talk today about some research that we did at the end of last year, published early this year in the form of an ebook. And that research was really looking at healthcare organizations and the way that they're using digital communications, primarily from a marketing and public relations perspective. Now, we're going to start by talking about one of those trends. We're going to kind of work through it and know from the pre-registration information that a number of people have actually gotten our ebook and have looked at that. Hopefully the fact that you're here means that you found that to be valuable. Worry not, we're going to be looking at the data in some different ways than the ebook does. And of course, the ebook covers more of the numbers than we do. Today, we're also going to do a little bit more interpretation of some of those things and look behind the numbers a little bit to try and understand what that means in the real world. So it's going to be a different experience. If you're interested in the ebook, of course, you can get that from geonetric.com/survey results, and we'll have that URL sprinkled throughout the presentation as well. One housekeeping tip before we get into that data, and that is just there's a couple things that I'm going to be throwing around just in the way that we cut and presented the data. We have 250 responses to the survey, and it really represents a cross-section of the healthcare space. And as you all know, that means really small organizations, clinics and specialty hospitals and critical access hospitals, and, organizations like that, up to very, very large, multi-state, many-facility regional providers. And so in order to try to get this data down to a point where you can look at it and say, these are organizations sort of like me, and these are the things they're doing, and therefore that gives me something to kind of compare against. We've split things by peer group, and so the terms I'll throw out throughout this are community and specialty providers, and again, that's everything down from 0 beds to about 200 beds, although they average something in the 70 to 75 bed range. We've got large providers that start where those community and specialty providers end and go up to about 1,000 beds. And then we have those very, very large regional providers, and those are more than 1,000 beds, averaging something like 1,400, 1,450 beds as an organization. Of course, now, bed's not the only component to sizing, but it's an easy number for us to look at and compare as we think about things. So as I throw those terms out, you'll understand. So the first trend that we're going to look at is just sheerly the amount of activity going on in the digital space. And one of the questions that I think captures quite a lot of that, so we asked if organizations were involved in a major overhaul of their web presence, sort of that destination site that's at the core of our web strategies in most cases. And the numbers that we got here really surprised us in a positive way, I suppose, but we've had an awful lot of activity. The couple of bars here that we see, the blue bars on the left, are that they've completed one essentially within 2013. The red bar, it means that at the end of 2013, they were in the process of doing an overhaul. And then those orange bars mean that they're planning to do an overhaul, but really hadn't started doing that quite yet. And so 41% of organizations at the end of 2013 were in the process of overhauling their sites, with another quarter of organizations having completed that in 2013, and almost 20% looking to do that in the coming year as well. It just hadn't quite started that yet. Now, as we look at our different peer groups, you see the distributions there aren't even. By the end of this year, we'll see a lot more of those big organizations having gone through and made this happen. But actually, as we look at it, those organizations sometimes have a hard time getting the momentum going. Those big regional providers often, it's a little bit like herding cats. A lot of moving pieces, many times, many different digital properties that they're managing. And so they've been a little slower to start adopting, but as they often do, they'll have much broader adoption before we know it of some of the new things that we'll be talking about here. So the big thing that seems to be pushing this along is this hugely growing mobile component to our traffic. We all know, and certainly if you don't wander through a reception area in your hospital or the waiting room in your ED, and you will see everyone's on phones, everyone's on tablets as they sit there waiting. This has become a much bigger piece of the overall puzzle, clearly the single biggest growth area in terms of the digital audience that we're engaging with. And just this is trends. This is not from the survey, actually. This is from a data warehouse that we maintain of our clients. So 50 some odd healthcare organizations, and again, running that same span across the board. The thick blue line in the middle is the average percent of traffic coming from mobile devices, and that's both tablets and phones. And then we sort of do one standard deviation up and down to kind of give you an idea of how broad the spread is within that. And so back in the beginning of 2011, 1 in 20 visits to our sites were coming from mobile devices. By 2012, it was 1 in 10. By 2013, it was 1 in 5. In January of this year, it was 1 in 3. We had a full 33% of traffic to the sites that we keep an eye on anyway that were coming from these mobile devices. So it's become a huge piece of the pie. Certainly not the majority, but growing awfully quickly. And so we asked some questions about how organizations were responding to this. And I've been on record for the last couple of years here that responsive design is the best way to address this growing mobile audience. We'll talk about the benefits and the reasons for that in a moment. If you're not familiar with responsive design, this is the site designs that adapt based on screen size and other elements. Do you have Flash or do you not have Flash? Well, let's give you something different based on that. So for many of those mobile devices that don't support the technology, they're still getting a good experience out the other end. Now, about a quarter of hospitals and health systems had that in 2013, another 42% planning to add that here essentially within 2014. So it's clearly been a big driver. And if you look at those numbers, not surprising, those line up very, very closely to the percents of people who are overhauling things that we looked at just a moment ago. Now, the distributions within the peer groups are not the same. It's not the only thing going on from that perspective, but we see here again that same pattern. Those large organizations, that middle group, able much, much more quickly to do this because while they're large and have resources, they're not so large that the size of the organization, the number of different pieces makes it difficult sometimes to execute on these things. So almost 40% of those organizations at the end of 2013 had this. However, the regional providers have that momentum, and a huge number, 73%, were in the process at the end of last year of putting that in place. Now, we asked questions a number of different ways. And again, as we look at things today, we're sort of cutting across many of the survey questions, pulling themes out. And so while we saw 42% of organizations putting a responsive design in place here in 2014, we also saw a number of organizations taking what had been the best approach available to us as of a couple of years ago, doing standalone mobile sites. So 16% are still adding that. Again, many, many organizations looking at different ways to adapt to this growing piece of the audience pool. Now, we also asked a lot of open-ended questions, and so I've tried to include some of the commentary in here just to add some voices from the survey into our discussion today. And most of those were the form of, whatever thing we're talking about, functionality, for instance. What are the most valuable things, and then what are the least valuable things? And this, I think, summed up what a lot of organizations were saying. Certainly a lot of people listed things they did like. Not all of them hate what they have today, but there's a certain amount of unhappiness, I think, with what's going on, or what people have now. It does appear that a lot of organizations have been holding off because of some of the economic pressures that we felt in the last couple of years, maybe longer than they would have liked to go through and do some of the upgrades that we're seeing happening in large numbers today. But a lot of excitement about new things coming, and in particular, responsive design called out very, very often as one of those value adds that many organizations feel that they'll be adding as they go through and overhaul things here in 2014. Now, responsive design as a technology, I think, brings a lot of interesting things to the table. Ultimately, we're doing it because we want to make sure that our site works for all of the consumers who choose to engage with us from a digital perspective. And we're trying to create a better experience. Hopefully, as a part of that, get a better level of engagement and more interaction and conversion out the other end of that process. That is the thing you should always focus on as you go through that process. But there are some secondary benefits to this as well. One of those is SEO, and I know a lot of organizations are very focused on the SEO question. It's become much harder to do that sort of very heavy optimization that many people wanted to do or did do in the past because of some things that Google has done. This is one of those areas where Google has drawn a clear line, and we see it in the numbers, that responsive design has some clear SEO benefits. Google certainly does not want to send people to your site from a mobile device, phones in particular, if it's not going to work for them when they get there. And so Google's put a lot of infrastructure into place to test sites for how well they work on various mobile devices. So if you have a standalone mobile site that's optimized for phones, it says, okay, that's great. Google's also been very clear that responsive designs, the design that basically adapts to a wide range of devices based on different configurations, is in fact their preferred solution to this problem and where they give the most sort of bonus points, if you will. There is also a certain degree of future-proofing in responsive design. Again, it's going to adapt to a number of different changes in sizes and capabilities. It won't be perfect for all of the devices that may come down the road, but we saw as people were doing standalone sites, they started doing standalone sites for phones because that's what mobile meant for a long time. As tablets came out, they would in many cases create a second standalone site. And then we have these very large phones and very small tablets that kind of have this gray area in the middle. And we saw some recommendations from the UX community out there. kind of pushing that forward and saying, hey, maybe you should create actually one for those mid-sized devices as well. And in the end, you have an awful lot of different things that you're juggling and having to support. Responsive design deals with all of those things very, very nicely. As we get down to watches and Google Glass and things like that, it may or may not convert all the way to those things, and we may have to adapt a little further what we're doing from a responsive standpoint. But as new phones come out with different configurations and different screen sizes and things, responsive designs adapt very, very well to the vast majority of those. Now, responsive design in and of itself has been a huge shift for the industry, but it's actually turned out to just be the starting point for a lot of the design shift that we're seeing out there. Sites that are rolling out today with new design look very, very different even than the early responsive designs that we were seeing organizations put out there 18 to 24 months ago. Big trends going on here. We're seeing this move to very, very large images on the screen. We're seeing a movement to what's called flat design, and this is a sort of one of those terms that lived in the design community for a while, and I think started to hit the mainstream community when Apple came out with iOS 7, which was very notable for its use of this approach, kind of very minimalist design there. We're also creating much more app-like experiences with these things, much more gesture support, and other things that now within apps have become relatively common. And so we're pulling these same things into mobile site designs with responsive design in the same way. For instance, in the upper left and right corner here of the screen, you see the three little lines. We refer to that internally as the triple cheeseburger. I'm not sure if it's got a real name or not. In the upper left, we have a little car. And so by either tapping one of those or swiping left or right from the edge of the screen, the whole screen actually slides over, much as Facebook does within its app or within its mobile site, to either get to locations or to get to the menu. And so as this screen real estate becomes very precious, we don't have to take huge amounts of it for the menu, because now people have sort of become to recognize, hey, that's where the menu's going to hide, and I have a couple of different ways to get to it. There's also some things from the technological perspective that have made maintainability easier. We'll talk about those a little bit with design here. So here's a couple of examples of some of those techniques. You see this is mercycare.org, the Mercy Hospital in Cedar Rapids, Iowa. Very, very large images there with some things laying on top of it. And they have many different images there. So as you refresh the screen, different images pop up. In the past, if they wanted to add another image to that, that would have been maybe a day or two of Photoshop work to actually go through and overlay all these things and slice those things up. It was kind of a mess. And the reality is now, those things are just overlays. And again, that's less of a responsive thing and just some new technologies that are out. Now you can just drop a new image in and all those other things sit on top of it. So much more maintainable sites from this perspective as well. And then as it shrinks, it changes and so forth, and it looks actually a little bit more like the site on the right, which is an Asante site. This is a long scrolling site, uses some of these big images as well. A lot of flat design concepts as well. And you see, there's not as many buttons, there's not as much framing around things, you're interacting with the content in many ways more, and then it is a long scrolling page. And in fact, if you click the menu item, instead of going to a second page for most of those first click experiences, it's actually scrolling you down to another place on the site. Now, it gives multiple ways to interact with things, but if you're on a tablet, if you're on a phone, or for that matter, if you're on a desktop that now has touch screens, because we have many of those out there now as well, that swiping or that scrolling approach is a much more natural way to navigate a lot of these sites. And so it allows for those things, depending on the device, there are many different ways to get to what you want in a very natural way. So again, a lot of those boxes that we draw on around design to say these things are okay and these things aren't, much of that has just gone out the window. We're seeing really a revolution and the sort of a volume of change in the design approach that we just haven't seen in many, many years in the web realm. The second big trend that we saw in the survey, and again, kind of cutting across a number of the different questions out there, related to content. And content's always been important on our sites. However, it hasn't always gotten the time and energy and respect that it ultimately deserved. Much of the focus here, I think, has really come not so much from the fact that we just all recognize how important great content is on our sites, but has sort of been pushed down from on high from Google. Google's made a lot of changes in the last couple of years. Penguin, Panda, Hummingbird, these are big changes to the algorithm that have happened here over the last couple of years. And at the end of all that, as well as a couple of other changes they've made in terms of the sorts of data they share and things like that, they've really tried to change the basis of the SEO industry. SEO used to be about doing a lot of tweaking and looking to see how you ranked and looking to see what keywords people came in on. Google shut down a lot of the data there. either directly or indirectly. So you just can't do those sorts of things anymore. And they're putting out the clear message. We want you to create great content. We want you to create a fair amount of great content. We want that content to be shared. We want people to engage with it. And if all those things are happening, you will rank well. And so having just great content and content that people will share and content that people will engage with, and frankly, content that's uniquely valuable, which oftentimes is a challenge in and of itself, has become a greater priority for organizations, and healthcare is no exception. Now, within the open-ended questions, there was a lot of unhappiness with content. A lot of organizations, or at least the people who run the digital realm, recognize that they haven't had the resources to do the kind of content they would like to do. They have a lot of content that's not being kept up. We have a little bit of a Goldilocks issue here. I don't have enough content. I have too much content. My content's too fluffy. My content's too static. And so that just right point is awfully difficult to accomplish. But we do see organizations adapting their approach, and in particular, putting resources behind this. This wheel is something that will appear a couple times throughout the presentation, and what this is looking at, within that core web team, how are we spending our time? And that's, if we have one person, how's that one person spending their time? If we have 20 people, how are those 20 people spending their time? And just breaking it out on a percentage basis, it turned out the percents here didn't differ a lot between those different peer groups. So we're just looking at the whole thing all together. Now, very surprising to me here, the content areas. Content web writing should be a priority, so I was glad to see that it was at least moderately high priority in terms of the places people are spending time. The one that surprised me, though, was content strategy. This is a relatively new discipline, really just started to hit the front burner here in the last couple of years, and organizations now are spending more time on that content strategy than they are on web writing, at least within that core web team, almost as much time as they're spending on general web administration, which I think is fantastic, but was quite a surprise to our team. Between those two things, which are the most direct content-related items, almost a quarter of time being spent from web teams related to content, and certainly much more spent there than on things like design or digital marketing or SEO. Now, in terms of where that content's getting generated, and again, we're not talking about those third-party health libraries and things like that. This is really the content specific to the organization. Most organizations at this point are using an in-house writing staff, or those are the resources that they have available to them. We are seeing growth from surveys that we've run in some past years, more and more use of outsourced writing capability. That's an option that's sort of hit the table for a lot of organizations. But we're still seeing a fair number of organizations, and particularly those community and specialty organizations, where they just don't have any good options in terms of having some writing capacity available to them. Now, of course, as organizations look at the web, we would all love to have a widely distributed content development network within our organizations. And so outside of that web team, we asked how many people are involved in writing. And the answer ultimately is not a lot. A quarter of organizations have 0 people, have no resources outside of that core web team doing content development. And even if you look at the next couple of categories there, up to 2 outside writers, up to 5 outside writers, those are really a small number of trusted individuals, probably within the marketing communications departments, who they've granted access to do some content creation. And it's a really relatively small number of organizations who have really built a robust community of content developers within the organization. And we've learned both from conversations with some of these folks, as well as just some of the comments that we got. It's a fair amount of work to do that. It's not like you can just hand that over to large numbers of people in the organization and get great writing back. Many people just aren't able to write for this medium. They don't know how to write for this audience, or they just can't write for healthcare very well in a way that's really consumable by people who aren't in healthcare. And so there's some expertise in a lot of different areas here. The organizations that are doing it well are putting a fair amount of energy into identifying the right people in the organization, into training them, into supporting them, and oftentimes into building communities of practice where some of those content creators can support one another, as well as someone from within that core web team providing them some support as well. So it's a fair amount of energy and effort, particularly to get this started up front. If you get to the large number of content contributors, I think it can be very valuable. For a lot of organizations, I think they keep it tight because it's just easier to use a small number of known good writers that are sort of close to the fold than it is to start rolling it out to more people in the organization. We asked a lot of questions about digital marketing as well. And when we asked what portion of marketing efforts included a digital component, averaging things sort of across the board here. So a little bit difficult slide to understand without some commentary, and so we didn't include this in the ebook, but we certainly asked people this as an open-ended question and then grouped it up into some different groups to get a sense of what the distribution of this stuff was. So the blue bar on the left, the light blue bar, is essentially saying none of our marketing efforts have a digital component. The purple bar over on the right is essentially saying everything that we put out from a marketing perspective has digital components, and then different groupings in between. And from this, you can see that we've got quite a wide range of adoption of this into the marketing mix at this point. Community and specialty providers, again, I think are particularly interesting. The largest group of folks out of any of the peer groups that basically say, you know what, nothing we do has a digital component. And within the commentary, we saw a number of organizations specifically calling out and saying, you know what, our audience we still feel is reads the newspaper and watches TV, and we just don't feel like the web is a great way to connect with them yet. Whether they're right or whether they're in denial is, I think, a discussion for another day. But certainly they've played that out in terms of the strategy they use and the approach that they use with the digital marketing mix. On the other hand, those community and specialty providers also have by far the largest group of organizations that are saying everything we do has a digital component. And I think between tight budgets and frankly, just the scope of things that they're dealing with, a relatively small number of people involved in marketing and not a lot of moving pieces, when they say we're going digital, they're able to go digital and do that in a much more comprehensive way. Whereas, again, those regional providers, lots of moving pieces, herding cats, all of that, even when they say we want to go all in, actually getting there is a huge undertaking. It takes a great deal of time in many cases to actualize that in their real efforts. We asked about what was most and least valuable here, as we did with other things. And so it was pretty clear coming out of that the website, that destination website, was still felt to be the single most valuable item that they had in their digital marketing arsenal. But there's a much greater understanding that this no longer stands on its own, that this is just one piece of the overall digital ecosystem that we're living in, and that it includes social media, certainly, and includes a number of different advertising vehicles, and to some extent includes a lot of integration of online and offline marketing approaches in a way that a couple years ago we really didn't consider that strongly. So when we talked about online advertising specifically and looked at that, a wide range of different channels being used for that pay-per-click style advertising. Google AdWords, not surprising, near the top of the list, maybe a little bit surprising that local websites beat that out. And that's, your newspaper's website, the radio station website, maybe some other local information and content sites as well. Now, to some extent, again, from some of the comments and certainly some dialogue that we've had with some survey participants since we got the numbers, it seems as though a lot of that comes from the bundling that happens. So when the TV station comes to you now, they're not just selling you TV advertising, but when you do TV advertising, they're also putting together bundles that include some other channels out there. So that's a part of it. But I think a lot of organizations are also seeing it as an effective, targeted way to reach the audience they serve. And so they're just using it from that perspective. Facebook ads is pretty close on the heels of Google AdWords. And I think, certainly as we've been advertising out there, some kinds of campaigns have had great success through that channel. But there's a lot of other websites out there as well that are getting used. And in some cases, I think have become very productive tools in the tool set. And so I include the rest of this not as a direction, but more just to get you thinking about the fact that it's a big, wide internet, and there are lots of things you can do. If you're doing radio ads, you can turn around and do Pandora ads. And of course, even in the search ad space, while Google has the largest number of eyeballs, those people who are on Bing, for example, are not going to search on Bing and on Google. So very often there are opportunities to reach out to a different set of consumers through a second paid advertising channel like that. And sometimes the audiences are significantly different, that those advertisements will be of different effectiveness, oftentimes at very different price points as well. And again, a little bit of commentary here to back some of this up. A lot of organizations seeing Facebook ads, banner ads, other things being very successful for them. And again, there were a number of comments that sort of echoed some of this. All right, we also talked a fair bit in the survey and asked a number of questions in the survey about social media. And so, again, no surprise, Facebook and YouTube are pretty well universal within the healthcare space at this point. Twitter getting pretty close to that as well, although there's a certain, certainly a group of holdouts there yet. I found it more interesting actually to look at what organizations are getting into in some of these spaces for the first time, both in social media and in marketing channels overall. You can see here, obviously, Pinterest is getting a good amount of traction. Instagram is getting a good amount of traction. Google Plus is getting a good amount of traction. Even down at the bottom, Vine, very new channel, but last year's social media darling to be sure, that micro video format, only 6% in 2013 using that tool, but that's expected to more than double, adding another 8% in 2014. And of course, Instagram added some competing offerings in that space as well. So we may see that micro video format over the next couple of years becomes a regular part of the arsenal. Now, looking both at social media and other digital marketing tool sets, these were the things that overall are getting the biggest boost here in 2014. And at the top of the list, again, another shocker to us. After wallowing in the shadow of social media, its sexier cousin, for years now, email marketing has just made a resurgence. It was the single largest new adoption category here, with 15% of organizations taking on email marketing for the first time. Now, email marketing, I think, has gotten a lot of traction for many reasons, but I think, again, much of the story comes down to mobile. We all have these smartphones in our pockets, the vast majority of us anyway, and now when we have 5 or 10 minutes, we're getting that out, we're looking at email. And the interesting thing is, if I only have 5 minutes, I'm not going to get involved in a conversation that's going to require me to make a big response to whatever email I'm opening. Therefore, I'm much more likely to use that couple of minutes to look at an email newsletter or something like that I might be receiving, whereas on the desktop, I might not have taken the time to do that because I'm much more engaged with a different part of my email. So ultimately, we're seeing a lot of engagement through email. A lot of organizations are seeing a lot of value out of it, and therefore it's growing. No surprise there. Content marketing, almost a little bit of a strange entrant into here because it's a little bit different. It's not just a tactic or a platform in the way that blogs or Instagram are, but it's really much more of a marketing philosophy in a lot of ways. But there does seem to be a certain amount of recognition that we need to talk about ourselves much less than we have in the past. Not that the content about, these are our services and we have great doctors, not that shouldn't have a place somewhere, but if that's all we're saying, then really for most consumers, most of the time, we're pretty boring. And so this idea that we should be developing more content that really is engaging consumers at many more parts of their life cycle, and certainly their experience with any condition or disease that we might want to engage with them around, is becoming just more readily there. And I think many of the tactics that we see here, email marketing, blogs, Pinterest, and Instagram, certainly fit into that. But these other channels also growing as well, blogs, Pinterest, Instagram. Pinterest in particular, I think, is fascinating. We're seeing a number of healthcare organizations start to engage here. Many of them are doing nothing more than grabbing a name on Pinterest and doing a couple of token pins to have something out there. Mary Greeley in Ames, Iowa, has been a little bit more aggressive, and they're seeing some good results out of that. They're starting to see some engagement on the platform. They're starting to see more clicks coming through. Still, at this point, healthcare has not found the sweet spot. The DIY community, fashion community, food community, there are sites there where really they're getting the lion's share of their referral traffic coming from Pinterest. We're not there yet in the healthcare space, but given the demographics of the audience that's here, which is to say primarily women, primarily a little bit older, this is not a teen or early 20s audience, in many cases much higher income, good insurance, all those sorts of things, it is a very attractive audience to go after. And that's really what I think is drawing a lot of healthcare organizations into the space. Although at this point, I haven't really seen any of them hitting home runs here. I think there's a lot of opportunity. Across the board with these digital tools, almost everything that appeared in a most valuable also appeared in a least valuable. Maybe not in equal proportions, but we certainly see all of these things getting a very mixed review when we get down to the value question. Now, to some degree, it was interesting because different people were clearly using the term value and evaluating the value in very different ways. But I think the more important message here really comes down to, hey, none of these things are slam dunk. Any one of these things executed well with a commitment, the right content, the right kinds of engagement can be a very valuable tool. But simply saying, hey, we're going to do email and not doing all of those things, not executing well on that, ultimately it's going to fail. And so any of these things, it really comes down to execution. They are tools, and the value that you get out of them is very closely connected to how well you do them. Again, I mentioned that we've done the survey in some years past. It's been a couple of years since we've done one. When we've done this in the past, the single area that got the most attention and the most questions was around staffing and budgeting. So we built out the question set this year a little bit in this space. And you'll see we slice and dice the data in a couple of different ways in order for organizations to really attempt to benchmark themselves against the industry. So the first thing we asked, and you'll remember that wheel from before, we actually asked, how many FTEs are being spent, how much time actually, staff time is being spent in each of these different areas. And so, we broke that out and we split it by peer group, and this was what we got out the other end. So the community and specialty organizations average 3.5 full-time equivalents, essentially 3.5 staff members on digital. Now, looking at that in a different way, that's about 1 FTE per 20 beds. You'll remember there were 70, 75 bed average within that peer group. Large providers, not surprisingly, have more resources, 4.5 FTEs, but it's not a linear correlation. It's not like, doubling the number of beds doubles the amount of staff. They have 1 FTE per 95 beds. Regional providers, again, those very, very large organizations, again, understandably larger teams, are 8.3 FTEs, more like 1 FTE per 171 beds. And so you see there's certainly some difference going on. When we've done this in the past, we did the same sort of number of people per bed kind of equation. But we did it across the board. We didn't split it in peer groups in this way. And we just came up with a number. And I think it's been fascinating to see the benefits of scale, right? We all know that there's some benefit to scale. This sort of quantifies that in some very direct ways. And so those large organizations naturally have more resources, but on a bed-by-bed basis, not as many. And in fact, as we saw some of those trends earlier where, how long is it taking them to start to adopt responsive design and some things like that, you may even be able to make the argument that those regional providers are running too lean, that they don't have the staff to really jump on some of these things quite as quickly, although once the momentum gets going, of course, we're seeing they are able to adopt things in large numbers. Now, we also asked, in addition to the staffing question, we asked sort of the direct dollar investment question. So we asked, what's your budget for digital, not including staff? And so, again, we've got numbers, and they make sense. Community and specialty providers, about $42,000 a year, works out to $578 a bed. Large providers, about $190,000 a year, or about $417 per bed. And regional providers, about $359,000 a year, $360,000 we'll call it, or $210 per bed. So again, we're seeing those same economies of scale, played out in the direct investment as well. Although naturally, those very large organizations have substantially larger budgets available to them. So with that, we try and pull it all together. So we've assigned some estimations in terms of what staff members cost, and we figured out that component. We've paired that with the dollars of direct investment that are going in here, and we tried to put together what are organizations ultimately investing in their digital platforms. So, the overall number, about $645,000 a year total between staff and direct investment. The community and specialty, about $260,000. The large organizations, about $480,000. The regional providers, about $900,000 a year. So not insignificant numbers. Organizations are certainly spending more now than last time we ran the survey. As we break that all down on a per bed basis, this is what that looks like. So regional providers are spending about $210 on direct investment, $315 per bed on staff for a total of $525. Large providers, $417, $658. Community and specialty, $578, $3,075. So again, we see the economies of scale as regional providers are able, on a per bed basis at least, to be much more efficient. But there's something else as we start to look at the numbers here. You look at the regional providers, and they're spending about $1.50 on staff for every dollar spent on direct investment. Large providers, about the same, about $1.50 for every dollar spent on direct investment. Community and specialty providers are spending $5 per bed on staff for every dollar that they're spending in direct investment. And so ultimately, what we're seeing here is I think they're getting some real inefficiencies in the small organizations. And ultimately, I think what's happening there is that they find it very difficult to write the check. It's much easier for them to take staff, maybe staff that already exists in the organization somewhere, pull them in, get them engaged in the web, than it is to write a check for tools or outside expertise. The result of that being that they are probably overspending on staff in order to compensate for the lack of tools or outside expertise that may have been more efficient. And so that an interesting dynamic kind of popping out in the numbers there. Within this sort of discussion of budget, we asked what portion of your budget is represented by digital. And there was a survey done right at the end of 2012 looking at 2013 budgets and across industries, how much are organizations putting into digital? And it was a little north of 20%. I think it was about 22% of budgets, of marketing budgets spent on digital. Now, this was an interesting question because we actually had quite a lot of organizations indicating that their digital budgets were no longer coming out of marketing, that they either had their own budget or occasionally there was an IT connection there. And so that may have thrown off our numbers here a little bit. And I think we'll probably look at some of these questions in some different ways next time we query the industry. However, ultimately, the average worked out to be about 19%. And I apologize, we've got kind of black on black going on here. Down on the left, we've got 0. It grows. The group there, that second grouping there, that's clearly the largest single group, is about 6 to 10%. So while we have some organizations that are spending 25, 50, 100% of their budget on digital, we are in fact seeing the most common split is more like 6 to 10% of marketing budgets being spent on digital efforts. So the average staffing mix, just sort of looking at this one more time, a couple of things that I'll call your attention out of this mix. Content strategy, as I mentioned, really sort of surprised us as something that's getting as much attention as it is, almost as much time being spent there as in general web administration. Social media is one of those things that anecdotally we say this really sucks up a lot of time. So we attempted to quantify that here, and it turns out it's about 11.5% of staff time within these core web teams being spent on social media. Again, more than web writing, almost as much as content strategy. So yes, it does take a fair amount of staff time there, but we thought it was interesting to kind of quantify that. And then the single largest component was development. And this was an interesting one only because there are many organizations for which this number was 0. Lots of organizations have no development, quote unquote, resources within their web team. They effectively outsource all of that. And so offsetting that is organizations that are doing these things in-house, and in many cases having very, very large web teams in order to accomplish that. And so it was interesting that when all the math came together, that even despite the fact that many teams have little or no direct development staff on their team, that ultimately, across the board, it's the single largest component from a time perspective. All right, the last area that we'll look at here before Andy sums things up and we have some time for questions is that of strategy. And it turns out that in a lot of ways, web strategy is pretty tough. We saw that a lot of organizations really were struggling with having a web strategy that made sense. We asked a bit about goals, and while there were some great goals on this, there were a lot of goals that weren't very goalish, so we'll look at that in a moment here as well. But it really does appear that a lot of what we're looking at here in terms of strategies specific to the web, organizations are having a really hard time getting strategic with some of these things. They tend to be very tactical, very functional in the way that they approach a lot of things from a digital perspective. So there are a lot of stresses that we are seeing out there. And we asked some questions sort of outside of the web. What are the things that your organization is focused on? What are some of the challenges here? And financial challenges were far and away the thing that we heard most often for that. And it was represented in a lot of different ways. Some of it was sort of the declining reimbursement, reduced budget sort of description. A lot of organizations, or at least several organizations, use the term solvency, though. And I thought that was fascinating. We're seeing a lot of stress and a lot of organizations worried about as they try to deal with this one foot on the dock, one foot on the boat, change space that we're in right now. They're really worried about whether or not their organization will be capable of surviving the transition. And that came through much more clearly here than what I've heard in other places. So we thought that was just sort of a fascinating way to look at it. It's clearly pushing a lot of stress down on staff members. Obviously, there's regulatory changes that are at the heart of a lot of this. The ACA and all of the things that come along with that, like HCOs and HIEs. ICD-10 was still pretty high on the list. Maybe it would be today, maybe it wouldn't be with the pushing things off my ear. Hopefully it's still high on the list. Otherwise, we're going to end up in the same boat next year that we were in as we got close to rolling that out this year as an industry. And meaningful use too. And in particular, I think within the audience that we're talking to here, this is one that started to hit their radar in some new and different ways. As patient portals are coming online, we're finding that patient and family engagement requirement, where we need to get this specific numbers of patients and family members to get in, log in, do stuff with that data. We're seeing a lot of organizations feeling stress around that. And anecdotally, and within a couple of reports, I've started to see that. I suspect by the end of this year, we're going to start to hear a lot of organizations complaining that some of those criteria right there around the patient portal and use of the patient portal may be the thing holding them back from getting those NU2 dollars. And so I think a lot of marketing departments are starting to get tapped far too late in the process, frankly, and saying, hey, we've got this up, we've got it live, it's working, now you make it go. And that may or may not be something realistic given what some of these tools really are at this stage of the game. We're seeing a lot of indications of growing competitive pressure. Again, no surprise. As organizations are out there doing this, we're seeing more standalone surgical centers, we're seeing more acquisition of what used to be a minor competitor in our space by a major player who has resources and is likely to be much, much more competitive. We're seeing a lot of organizations just expanding their footprint organically and building new facilities that are going head to head with people that they used to play nice with in the past. And so that growing competitive pressure is very much on the minds of many folks as well. And then finally, we're starting to hear some discussion of workforce challenges, and in particular, as we move into these ACO and medical home models, challenges around primary care staff. And again, as we just kind of looking at some of the organizations expressing that, particularly as you get more rural, I think that's a bigger concern. We asked about formal web strategies here as well, and only about half of organizations in the survey had what they thought of as a formal web strategy. A little bit more amongst very big organizations, a little bit less amongst smaller organizations. But in many cases, it does appear that this is an exercise that they go through once every couple of years, and then it just kind of sits. So while 46% of those who have a web strategy updated annually, there's an awful lot who change it every 5 years or never. And there were a few people who said, well, we do it every 3 years or something like that. But within the web realm, 3 years is an eternity. And so we found it very interesting that many organizations weren't doing that. As we got into the open discussion component of things, there was a lot of, hey, we have this, but it's a nice exercise to go through, but it doesn't really guide our day-to-day work, or we build it and we put it on a shelf, or we put it together to justify resources, but we don't ever get those resources, so really we never use the strategy. There's a lot of that kind of discussion in there as well. As we asked about the goals, though, there were many people who expressed goals in very tactical terms. So we want to add a Twitter account. We're holding our strategy until launch, whereas it seems to me that the strategy should probably be guiding the things you're doing as part of a web overhaul effort. Use Facebook ads more. And those are very tactical. And we really wanted to see more goals that were, hey, we're looking to engage patients. We're looking to use the web to grow volume in these key service areas. Things that were more tangible, where they were potentially, or whether they stated them or not, to have real metrics attached to them and things like that. And really, a lot of the goals were very much, this is what's on my work plan for the next year. So even when they have, I think, formal web strategies, I think there are a number of places where those strategies may not be that strategic ultimately. However, there were also a number of organizations within this whole discussion that were indicating a lot of optimism for the future and some real opportunities to grow and be aggressive in their space.
Thank you, Ben. That was terrific. Let me sum up our webinar today for you. I always like to end where we began, and why trends from the trenches. And I like to ask our clients and our attendees, what do you see in your everyday life that really needs to be set into the context of what's happening elsewhere? I know there are several people who have attended today who we are working with on trying to create better online experiences for them, both for their internal employees as well as for the audiences outside. And that should not be underestimated. Who you're talking to really spans a broad spectrum. There are too many client situations where there's confusion, and it's interesting to see who among them are really engaged in the online world and who are not. But remember, the whole thing is to change the way you have your eyes. What are you seeing? What could you see if only you were able to put it into context? We hope this webinar has been helpful. to help you see, feel, and think in new ways. That's important that you do that because our brains decide by what we see and feel and how we think. And the data really is an affirmation of what we're already intuiting. And so the data today has become very powerful. Perhaps some of us could be of help to you along the way in this journey. In our next webinar on May 9th at noon, Dr. Charles Maudlin is going to be speaking on men's health. I can only tell you I've worked with Dr. Maudlin. He is at the Cleveland Clinic, and he's this year just completed his 12th annual Men's Health Summit. And then Cleveland Clinic actually has a whole men's health clinic. He truly believes that from a blue ocean perspective, the unmet needs of non-users are men, and men can really help you in many ways. Grow your business and think about how to help them. Both Ben and I are open for more conversations and for questions. Our information is here. This will be available to you about a week after the webinar. We turn it into a video, put it on YouTube, and we share it. And you may share it with all those who you'd like to share it with. So thanks again for joining us. See you May 9th. Have a great weekend.